Hey guys, how's it going? Yesterday we discussed a little bit about white coat hypertension. I said that some patients really have real hypertension and then they just call it as white coat hypertension, and then they do a disservice to themselves by just not taking the pill. I've seen many patients like that. Whenever they come to the doctor's office and the doctor says, hey, your blood pressure is 160 by 100, which is a whopping big number. And then the patient would say, no, doc. At my home, it's fine. I've checked it. So they'll just say that because they just don't want to take the pill. And then what they're doing is they're harming themselves. Because if you have high blood pressure for 10, 15 years, then that ends up causing a lot of damage, and it can cause just, not only heart attack, it can cause heart failure by itself. Like diastolic dysfunction, the heart muscle gets thick and then people's heart fail. So that's about the blood pressure. Now I'm going to quickly discuss about how some patient, they just say like, I don't want to take a cholesterol pill. Because these guys, they read a lot. And then they say like, oh, the cholesterol pill is just not good at all, so I don't want to take it. So, some of them have a really terribly elevated, bad cholesterol. The bad cholesterol is the LDL cholesterol. Normally, if it's less than 100, it's okay. But it's good to really keep it less than 70, okay? So some patients, when we check their cholesterol panel, it shows that their bad cholesterol is like 200, 230, something like that. So there are different kinds of, cholesterol problems like familial hypercholesterolemia, and then secondary hypercholesterolemia. You can classify it in different manner. And then sometimes it is just a hypertriglyceridemia. It's a different type of fat in the blood. And some people have pure hypercholesterolemia. So there are different ways to look at it. We'll discuss about that at a later time. Now I'm just purely discussing about just bad cholesterol, which is very high, like a 230. If the bad cholesterol is 230, that's really high. So those patients, if you left them alone in about 10 years, they're going to start having a lot of cholesterol buildup in the heart, and that's going to lead heart attack. So then the doctor gives them a statin drug, and statin drug is an established, wonderful drug to really bring it down, along with, of course, diet control, exercise, and controlling their diabetes and the other stuff. But some of these patients, they really are prefixed in their mind. They say because they read and they say cholesterol medicine is bad, it's going to cause muscle pain and all that. And of course, like any other pill, it does have side effects. But many of them are manageable, and they just need to bite the bullet and they just need to take the pill, but they just don't want to. And you know what they do? They just don't take it. And like physicians like me, I've been a doctor for 30 plus years. So when I follow them serially in the office, so we know that they're headed towards a danger. We have given them the pill, but they don't want to take it. And then boom, 10 years later, now they have a heart attack. Isn't that sad? Where you clearly predict that they're going to have a major problem because of the high cholesterol, but they just don't want to take the pill. So we'll keep discussing these kinds of things in our future posts. I'll talk to you later in my next post. Goodbye.